friends, welcome back to our channel Alert Sensation. This is Panchakshri. In this video, I am going to discuss about the next part of the pre-operative assessments. Pre-operative assessment in previous video, we are going to see about the goals and what is the first priority of the patient. When you go to the patient, you will go through with the patient in history and previous medical illness and previous any surgeries and all. In this video we are going to discussing about the investigations and ESA grading based on the patient condition and reduces the intraoperative complications and all. Along with this, the investigations is a major role as well as in the intraoperative complications as well as postoperative complications. We'll discuss about the investigations. What are the investigations should be done before the surgery in preoperatively? The in general common routine test you have to be seen in the preoperatively. First one is CBC, complete blood hemogram, blood hemogram you should be seen in complete. Okay, complete hemogram counting you should be seen in the preoperatively. CBC, complete blood count. In complete blood count, you will know about the hemoglobin, RBCs, WBCs, and platelet. All these counts are very important to the before the surgery for the surgical preference as well as anesthesia preference. Next is RFT. CBC, you know the complete hemogram. In the CBC, complete hemogram means hemoglobin, also platelet count, WBC count, RBCs count. All these are come under the CBC. Next one is RFT. RFT means renal function test. Renal function test is very important role. It shows the functions of the kidneys. Once you done with the RFT, you will know about the how kidneys are functioning. In this RFT, you have to be seen creatinine levels and urea levels. Okay. Next one is urine analysis. Urine analysis also you have to be seen in the before surgery. Next one is RBS and HbA1c. RBS and HbA1c, it is helps to diagnose a diabetic. If it is there, it is controlled or it's newly diagnosed. These all are considered in the preoperatively when you done with the HbA1c or RBC random blood sugar level you have to be checked before only. HbA1c, it is a very important role in the diabetic patient. In the diabetic patient, HbA1c should be in the control along with the medication. Next one is LFT. LFT means liver function test. Liver function test also is very important role in the preoperatively. Okay, in liver function test bilirubin, all these are come under the lipid profiles, all should come under the LFT. And coagulation profiles. In coagulation profiles, INR, PT, APTT, all these values are come under the coagulation profiles. Next one is ECG and echo. More than 40 years in male and more than 50 years in female, usually they are done with the ECG. In a nowadays severe condition with the in younger age also some conditions with the heart diseases. That's why ECG is very important. And once you done with the ECG, it is getting normal. It is okay. If it is any changes in the ECG, you have to be done through next investigation, echocardiography. Okay, ECG is normal, nothing to worry. Then if it is any variation in the ECG, then go through echocardiography. And male or female, that should be a X-ray is very important role in the pre-operatively. In some patients only, they are not advising the pre-operative. If it is needed, then only we have to be consider it pre-operatively. Okay, next one is, all these are investigations should be done before the surgery. Okay, before the surgery you should see all investigations, and along with the what are the medication they are already in. Next is ASA grading. Based on these pre-operative assessment, American Society of Anesthesiology, they are grading some like 1, 2, 3, 4, 5, 6. 6 grading they are given based on the patient physical examinations and pre-operative assessment. ASA means American Society of Anesthesia. They are grading the patient condition based on their previous history or else any condition. Okay. ASA 1 means normal healthy patient. ASA 1 means normal healthy patient. ASA 2 means mild to moderate systemic disease, not limit function activities. You know, understand? ASA grading 1 is normal healthy patient. The patient having no any comorbidities, not on any medication, all that are patient. It is fit for surgery and healthy. Its patient grading is ASA 1. ASA grading 2 means mild to moderate systemic disease, not limiting function activity. Mild to moderate systemic disease, mild to moderate. It is okay if a patient has cough and a cold. It is okay. It is a mild and moderate. Once it treated, it will goes off. Like this, that like systemic disease. Systemic disease like they are not limiting functional activities. All that are come under the ASA 2. Like ASA 3, severe systemic disease that limit that activity but not incapacitating. Okay. In 3, ASA grading 3, severe systemic diseases. Severe systemic diseases like diabetic and hypertension. Diabetic and hypertension, and along with the medication, all that are come under the ASA grading 3, severe systemic disease that limit the activity but not the incapacitating. It's limit the activities. Its effect on the activities. Okay, systemic activities, its effect on systemic activities that are come under the ASA grading 3. ASA grading 4, incapacitating diseases that is constant threat to life. Like ASA grading 4, incapacitating disease that is a constant threat to life. Incapacitating disease like kidney failure. You know, kidney failure, renal failure, CKD, all that are come under the 4th, incapacitating diseases that are constant threat to life. They are constantly threat to life longing. That patient come under the ASA 4. ASA 5 is moribund patient who has very little chance to survive with or without operation. Those who are patient incapacitating disease, like moribund patient who has very little chance. Patient who has little chance to without surgery, that patient comes under the ASA 5. Okay. Next, ASA 6 is brain dead patient for organ donation. Which patient is gone under the organ donation, cadaveric patient, that patient is considered as an ASA grade 6. One more is there, ASA grade E means emergency. It is an emergency life threatening procedure. It is considered as a E. Emergency means like it's a life threatening. Head injury cases all are life threatening. They have to be done in emergency only. That's why it's an emergency. Along with the along with that diseases, they are dividing these 1, 2, 3, 4, 5, 6 with the emergency. Patient condition, it is emergency, it is E. If it is healthy, ASA first 1E. Like they are categorized the patient based on the pre-operative assessment. Like next video, the next is what are the instruction given to the patient before the surgery, like pre-operative assessment. In the pre-operative assessment, I am going to discuss in the next chapter.